If you're over 60, you've probably been told countless times that taking your daily vitamins is one of the smartest things you can do for your health. Vitamin D for your bones, vitamin E for your skin, B-complex for your energy, right? But what if I told you that some of those same vitamins could actually be increasing your risk of stroke overnight? I know that sounds shocking, even unbelievable. But stay with me, because as a doctor who has worked with thousands of seniors, I've seen firsthand how the very supplements people trust to protect their hearts and brains can, under the wrong conditions, do the exact opposite. In fact, several recent medical studies have revealed something deeply concerning: certain vitamin combinations, taken in high doses or without proper medical guidance, can silently thicken your blood, damage your arteries, and increase clot formation. And if you're over 60, where your blood vessels are already more sensitive and your circulation slower, this can quickly turn into a perfect storm for a stroke. Now, don't panic, not every vitamin is dangerous. But the truth is, many seniors are unknowingly consuming far more than their bodies can safely handle. Between fortified foods, multivitamins, and individual supplements, your daily healthy routine might be quietly sabotaging your blood flow every single night. In this video, I'll break down the science of how certain vitamins can trigger dangerous blood changes while you sleep, which specific supplements are the biggest culprits, and how to replace them with safer, natural alternatives that still protect your heart and brain. So if you or someone you love is over 60, grab a seat, because by the end of this video, you'll understand exactly which vitamins to keep, which to toss, and how to protect yourself from this hidden risk that's affecting millions of seniors around the world. Before we talk about the vitamins that can quietly raise your stroke risk, it's important to understand why this risk naturally increases as we age. Because once you know what's happening inside your body after 60, you'll understand exactly how even a small imbalance, like too much of a certain vitamin, can tip the scales toward danger. Let's start with a simple fact: your blood vessels are not the same at 60 as they were at 30. Over the years, arteries lose their flexibility. They become stiffer, less elastic, and more prone to collecting plaque, that fatty buildup made of cholesterol, calcium, and other substances. Think of it like a garden hose that's been left out in the sun too long; it becomes less flexible and easier to crack. Now, when your arteries harden, your heart has to pump harder to push blood through them. This raises your blood pressure, and high blood pressure is one of the most powerful triggers for a stroke. But that's not the only issue. As we age, our blood composition also changes. The body tends to produce more clotting factors, which means the blood gets a bit thicker. Combine that with slower circulation and weakened vessel walls, and you have the perfect environment for a clot to form, and one wrong clot in the brain can lead to a stroke. Lifestyle plays a major role too. Many seniors move less, sleep less deeply, and sometimes eat diets heavier in processed foods or sugars. Each of these factors contributes to inflammation, a silent destroyer of blood vessels. Chronic inflammation makes it easier for plaque to build up and for blood to stick together instead of flowing freely. And here's where things get tricky: vitamins and supplements can amplify or reduce these risks, depending on how they're used. Some vitamins thin the blood, others thicken it. Some boost energy but increase oxidative stress if overused. And when your body is already walking a fine line between balanced and overloaded, the wrong dose or combination can quietly push you over the edge. So, after 60, stroke risk isn't just about blood pressure or family history. It's about the tiny daily habits, including what you swallow every morning. And in the next section, I'll explain the shocking truth about how certain vitamins, taken with good intentions, can silently turn into hidden stroke triggers inside your bloodstream. Most people think of vitamins as harmless, something you can take as much as you want, whenever you want. But here's a truth many seniors don't hear often enough: vitamins are powerful biological compounds, and in excess or in the wrong combinations, they can change how your blood, heart, and brain function. You see, the body is an incredibly delicate system. Every vitamin interacts with enzymes, hormones, and minerals that keep your blood pressure, circulation, and oxygen flow balanced. When you add more of one vitamin than your body needs, it can throw off this balance, and sometimes, it does so silently. Let's take a closer look. Some vitamins, particularly the fat-soluble ones like A, D, E, and K, don't leave your system quickly. Unlike water-soluble vitamins such as vitamin C or B-complex, these are stored in your liver and fatty tissues. That means if you take a large dose every day, even if it seems healthy, your body keeps stockpiling them. Over time, this buildup can cause subtle but dangerous effects. For example, excess vitamin D, when combined with calcium supplements, can increase calcium levels in your blood, making your arteries harder and less flexible. That stiffness increases blood pressure and makes it easier for clots to form. On the other hand, too much vitamin E, which people often take for its heart protective benefits, can thin the blood too much, leading to internal bleeding or hemorrhagic stroke. Even vitamin B6 and B12, when taken in high doses, can increase homocysteine levels in some people, a chemical that directly damages the inner lining of blood vessels. Damaged vessel walls mean your blood platelets are more likely to stick, clot, and block oxygen flow to your brain. But perhaps the most alarming part is this: most seniors aren't even aware they're overdosing. Many foods today are fortified with vitamins: breakfast cereals, juices, snack bars, even bread. So when you combine a fortified breakfast, a multivitamin, and a few individual supplements, your body could be getting 3 to 5 times the recommended daily amount, without you realizing it. And remember, your liver and kidneys slow down as you age. They can't flush out excess nutrients as efficiently as they once did. So while your doctor might have prescribed a mild vitamin D dose 10 years ago, your body today may handle it very differently. This is why we've seen a surprising trend in medical research. People who take very high doses of certain vitamins have a slightly higher risk of stroke or heart attack than those who meet their vitamin needs through balanced diets. It doesn't happen overnight. It's the slow, quiet accumulation that causes trouble. It's not that vitamins are bad, they're essential. But the key is balance. When the body has too much or too little of any one nutrient, the harmony between blood thickness, vessel strength, and oxygen flow can collapse. And in seniors, that collapse can happen suddenly, often at night, when circulation slows down and blood pressure naturally dips. So before reaching for that extra supplement, it's crucial to understand how much your body really needs, and how much might be putting you in harm's way. In the next section, we'll reveal the 4 specific vitamins that are most commonly linked to higher stroke risk, especially when taken without medical guidance. And I promise, some of them will surprise you. Now that you understand why the body becomes more sensitive after 60, let's talk about the 4 vitamins that can quietly raise your stroke risk, especially when taken in excess or in the wrong combinations. These are vitamins most seniors take with full trust every single day, believing they're doing something good for their heart and brain. But under certain conditions, these same vitamins can turn from protectors into silent threats. The first one is vitamin E. For years, it's been marketed as a miracle nutrient, the heart protector, the skin saver, the antioxidant powerhouse that fights aging. And while it's true that vitamin E helps protect your cells from damage, here's the dark side very few people talk about. Vitamin E acts as a natural blood thinner. When taken in moderate doses, around 15 milligrams a day, it's beneficial. But when you take high-dose supplements of 400 IU or more daily, your blood can become too thin. That means if a small vessel bursts or a clot forms, your body can't stop the bleeding as easily. Several large medical studies, including research published by the American Heart Association, have shown that people who take high doses of vitamin E have a higher risk of hemorrhagic stroke, the kind caused by bleeding in the brain. And if you're already on blood-thinning medication like aspirin or warfarin, that risk doubles. So while vitamin E isn't the enemy, it's not something you should take lightly. It's far safer to get it naturally through foods like almonds, sunflower seeds, and spinach, where it exists in balanced amounts your body can easily manage. The next vitamin might surprise you: vitamin D, the sunshine vitamin. It's essential for strong bones, immune function, and mental health. But as we age, our bodies process vitamin D differently. Many seniors take both vitamin D and calcium supplements to strengthen bones, but this combination can sometimes go too far. When vitamin D levels in your blood rise too high, your body absorbs more calcium than it needs. The extra calcium doesn't just sit in your bones, it can start depositing in your arteries, making them hard and less flexible. This condition, called vascular calcification, silently raises blood pressure and increases the risk of both heart attacks and strokes. Some medical reports have shown that elderly patients with very high vitamin D levels also experience more arterial blockages. The key is balance. If you're supplementing, it's wise to get your blood levels checked regularly and aim for a safe range. Sunlight, fatty fish, and fortified milk can often give you enough vitamin D without risking toxicity. Then there are the B vitamins, specifically B6 and B12. These are often labeled as energy boosters and are heavily promoted for seniors dealing with fatigue or brain fog. But here's what's rarely mentioned: when taken in high doses, these vitamins can raise the level of a compound in your blood called homocysteine. Homocysteine is a natural amino acid, but when it becomes too concentrated, it damages the inner lining of your blood vessels. That damage makes it easier for plaque and clots to form, the perfect setup for a stroke. A 2019 study published in the journal Stroke found that older adults who took large amounts of B6 and B12 supplements were more likely to suffer an ischemic stroke compared to those who got these vitamins from food alone. You don't need megadoses to stay healthy, your body only needs a small amount daily, which you can easily get from foods like eggs, fish, and whole grains. The danger lies in overdoing it, especially with those extra-strength, B-complex pills that promise quick energy. Finally, let's talk about vitamin K. This one is tricky because it's essential for blood clotting and bone strength, yet it can become risky when taken in excess. There are two main types: K1, found in green leafy vegetables, and K2, found in fermented foods. The problem arises when people take vitamin K supplements while also using blood-thinning medications. Vitamin K can interfere with those drugs, making the blood thicker and increasing the likelihood of clot formation, exactly what doctors try to prevent. Even small fluctuations in your vitamin K intake can throw off your blood's delicate balance. That's why doctors tell patients on anticoagulants to keep their intake consistent, not too high, not too low. The safest approach is to get vitamin K from a stable diet rather than from unpredictable supplement doses. Here's the critical point: most of these vitamin-related stroke risks don't come from a single pill. They come from stacking, combining multiple sources without realizing it. A fortified breakfast cereal, a multivitamin, a separate D3 capsule, a calcium supplement, and a green smoothie can easily push your nutrient levels far beyond what's safe. And because your liver and kidneys process everything more slowly with age, these nutrients accumulate quietly. Over weeks and months, the body gets overloaded, until one day, a simple, healthy habit triggers a very unhealthy reaction. The lesson here isn't to fear vitamins. It's to respect them. The line between just enough and too much gets thinner with age. Balance is what keeps your circulation smooth, your arteries flexible, and your brain safe. In the next part of this video, I'll show you which safer, natural alternatives and doctor-approved habits can protect your heart and brain health, without the hidden dangers of vitamin overload. So now that you know which vitamins can quietly raise your stroke risk, the next question is simple: what should you do instead? The goal isn't to stop taking all vitamins. It's to find a balance between getting what your body needs and avoiding dangerous excess. The truth is, your body often needs far less than you think, especially after 60. Let's start with the basics. The safest way to get most of your nutrients is through real, whole foods, not pills. Nature gives vitamins in perfect harmony, combined with minerals, fiber, and antioxidants that help your body absorb them safely. For example, a handful of nuts provides vitamin E along with healthy fats that naturally balance absorption. A serving of salmon gives you vitamin D and omega-3s, which protect your arteries instead of hardening them. And leafy greens offer vitamin K in a gentle, natural dose that supports your bones without pushing your clotting levels too high. If your doctor recommends supplements, always go for the lowest effective dose, and never combine multiple products that contain the same vitamin. Read the labels carefully. You'd be surprised how many foods and drinks are fortified today, meaning vitamins have already been added. When you add a supplement on top of that, your daily intake can double or triple without you even realizing it. Hydration and movement are equally critical. Thick blood and slow circulation are the perfect setup for a clot, and both can be improved simply by drinking enough water and moving your body regularly. Gentle walking, stretching, and deep breathing all help keep your blood thin and oxygen-rich, far more naturally than any pill ever could. It's also important to keep your doctor in the loop. Before starting or changing any supplement, ask for a simple blood test to check your vitamin levels, especially vitamin D, B12, and calcium. These tests are quick and inexpensive, but they can reveal whether you actually need a supplement or not. Taking something blindly, just in case, can sometimes be riskier than skipping it altogether. Another key is to support your arteries naturally. Foods rich in omega-3 fatty acids, like sardines, walnuts, and flax seeds, help reduce inflammation and prevent clots. Colorful fruits like berries and pomegranates strengthen vessel walls, while garlic and turmeric act as natural blood regulators. These simple additions can often replace the need for heavy supplement doses. And finally, don't underestimate the power of routine checkups. Blood pressure monitoring, cholesterol checks, and even a quick pulse test can catch warning signs early, long before they turn into something dangerous. So rather than relying on a shelf full of pills, focus on a balanced plate, clean hydration, and a steady lifestyle. Nature already built the perfect medicine cabinet, it's called food. When used wisely, it supports your health gently, safely, and effectively. In the final section, we'll bring everything together, a quick summary, the key takeaways, and a doctor's final advice on how to protect yourself from hidden vitamin risks while keeping your brain and heart strong for years to come. So, what's the real takeaway here? Vitamins are powerful, and that power can go both ways. They can protect your heart, brain, and blood vessels when used correctly, or they can quietly damage them when taken without care. For seniors over 60, balance is everything. Your body simply doesn't process nutrients the same way it did when you were younger. What once helped can now harm if the dose or combination isn't right. That's why it's so important to step back and look at your daily routine. Are you taking multiple supplements that overlap? Are you getting vitamins from both pills and fortified foods? Are you monitoring your levels with your doctor? These small steps can make the difference between protection and risk. Remember, nature already provides everything you need in perfect proportions, from leafy greens to fish, nuts, fruits, and sunlight. When you choose natural sources, your body knows how to use what it needs and safely eliminate the rest. Supplements should fill in the gaps, not overflow the cup. If you're over 60, promise yourself this: before taking another pill, talk to your doctor, review your list, and make sure your health choices are helping you, not silently hurting you. If you found this information helpful, don't forget to like this video, subscribe to the channel, and share it with a friend or loved one who might be taking supplements too. It could help protect someone you care about from a risk they never knew existed. Stay informed, stay balanced, and stay healthy. Your brain and heart will thank you.